Devin Morgan, lead physical therapist at Colorado Pain Care. I'm here today doing a video to show you guys how to test for sciatica at home. We're going to give you some tips on things you can try at home. If you see a problem with what we're showing you, you can come in the clinic and we'll help you figure things out. First thing we're going to do is a seated test to see if you have tension on your sciatic nerve. A lot of people discuss sciatica and there's some misconceptions about it, and we'll have more videos in the future explaining the differences of what sciatica may or may not be. But for the sake of this video, sciatica is a nerve type pain going down the back of your leg. We'll elaborate in the future. Right now, I'm going to have Colleen do these tests as if I'm not in the clinic to assist her. I'm going to instruct her through what to do at home, and this is what you'll replicate on your own when you have time. First thing Colleen's going to do is sit nice and tall. Next step for her, say we're going to test for sciatica in the left leg. She's going to extend her left knee all the way out. Go ahead. And now while she holds that position, she's going to dorsiflex and pull her toes towards her as far as she can. And then from that point, she's going to slump forward and touch her chin to her chest. A positive for this test would be an increase in back pain or pain running all the way down the back of the leg. If it's just right here, you're probably stretching your calf, so it needs to be something above the knee. So a positive for this test is going to be an increase in back pain, or if you feel a pull like a tight cord run down the back of your leg. This needs to be felt both below the knee and above the knee. It's a possibility of a false positive if you feel tightness in one or the other, because it could be tight muscles. If you get both and it feels like a tight cord from heel all the way up, that's a positive, or anything in the back. Go ahead and relax, Colleen. So the next test we're going to do is called a straight leg raise. Go ahead and lie on your back here. Colleen's going to relax in a supine position. And again, I'm going to have her do this on her own. It's more accurate if a clinician applies it to you, but for the sake of those at home, this is how you'll do it on your own to kind of see if you have a problem that needs to be addressed. First thing she's going to do is focus on keeping this leg straight, and now she's going to raise it like a rigid lever. From that point, Colleen, I want you to reach back here for your calf. Don't let your knee bend, and I want you to try to get to 90-90. Pull a little further if you can. Go ahead and rest right there. Are you comfortable in that position? Mm-hmm. Okay. So Colleen does not have a positive straight leg test. She does not have any sciatica. A positive test here would be a tight cord running down the opposite leg, something running just like the last test we talked about, a tight cord from the buttock all the way to the heel. If you don't feel anything at all, you probably don't have sciatica. Go ahead and come down. Okay. So our next test is going to be a combination of two different movements. It does not have a specific name, but it's something you can use to differentiate whether or not you have sciatica. If those first two tests we discussed give you no results, oftentimes sciatica is still missed, so we're giving you something a little extra to test yourself out. So first thing I would have a patient do, and Colleen's going to perform this for me, is flexion and standing. She's going to bend down and try to touch her toes. Go ahead, Colleen. So in this position here, the sciatic nerve is pulled tight as long as the knees are not bent. So when you do this test, don't flex your knees, keep them straight, bend as far down as you can. And it's going to be the same positive signs as before. Increase in back pain, a tight cord down the leg, or if it increases numbness, tingling in the feet, anything like that. Go ahead and come back up, Colleen. So if Colleen's positive here, the next thing we would test is her in lying to see if she gets the same result when she starts to flex her spine. We have to make sure that it's the nerve that's causing the symptoms and not something else. So this is how we differentiate. Go ahead and lie on the table, Colleen. So Colleen just completed flexion and standing to test for the tight sciatic nerve or sciatic nerve irritation. If we did get a positive test, we want to differentiate to make sure basically the component of sciatica is actually present. So we're going to have her do the same motion of her spine, but in a position where her sciatic nerve will not be pulled tight to see if she gets a different response. So what I'm going to have Colleen do is flex your knees up towards yourself, wrap your arms around the knees, and give it a little pull there. And then go ahead and relax. If you don't feel the same pain in the back as you did in standing with your legs straight, that's a positive for sciatica. That standing position pulled that nerve tight and it elicited a response that you don't get here when your legs are bent because the nerve's no longer on tension. So those are 4 tests that you can use at home to help determine if there is a chance that you have sciatica. If it's not really clear, feel free to come in the clinic and we can find out for sure. If sciatica is bad, usually those tests will elicit a response where you can reliably depend on it to know if that's what you have. If you have any further questions, you can come in for an evaluation. Call us at 303-GOT-PAIN.